Hi, I'm Scott Miller with Miller Family Pediatrics, and I was asked to do give a little information on what I am seeing currently with the virus, some of the things that we're hearing in the news, and some of the things that I don't think are getting out to our community in general. I've spoken with a lot of families since the very beginning of the pandemic, and a lot of things that we should be hearing about, we haven't. So I think the biggest thing that I'm seeing is the fear and anxiety about coronavirus, about getting sick, and it feels like there's nothing that we can do either for prevention or to help mitigate negative outcomes if we do get sick. So several things that I think we know to be very important. Vitamin D, especially living in Washington in the fall where we don't make vitamin D, it's really important to boost our immune system. Vitamin D and melatonin are two of the most important hormones for our body's innate immune system. So when we get a pathogen, when we get sick, we need our body to start working immediately. And so in general, we don't make it from about September to February. So I recommend for most people 5,000 plus international units of vitamin D every day until March, but also vitamin C and zinc, obviously. And then there's another amino acid that I strongly recommend called NAC. It's N-acetylcysteine, which is a very potent antioxidant, but also helps regulate our clotting factors, so that if somebody who especially is at risk has immune issues, that can be very beneficial at helping mitigate some of the long hauler things that we've seen, or any clotting issues. So those are, I think, just really easy things that we can all do to boost our immune system, and especially if we are symptomatic or positive for coronavirus, for SARS-CoV-2, that can be very helpful. And then there's also medication. So if you are positive and I'm 48, so if you're my age, older, and you're symptomatic and you're seen at an urgent care or an emergency department and they didn't give you anything, there's no prescription, you need to call your primary care. If they don't recommend anything, you need to keep searching out, because there are medications, there are therapeutics that anecdotally we know can be extremely important. Ivermectin is one that we've seen a decrease in viral replication within 2 days, like extreme decrease in viral replication in literally 48 hours. So very, very important, very cheap. It's actually an anti-parasitic, but that can be vital for especially at-risk patients. Again, hydroxychloroquine done responsibly at responsible doses, therapeutic doses early on in a disease. And then budesonide, especially if there's lung involvement, budesonide and dexamethasone can be a game changer for at-risk people. So there's more that we can do besides just going home and quarantining and just going, I hope I get better. And I think that we haven't done a very good job about getting this information out, and there's so much disinformation about these things. This isn't political. This is about us making sure that everyone has accurate information on things that can be done to make sure that we don't have negative outcomes from this virus, or from any infection,